Hello everyone, welcome to Veterinary 101 channel. Today we're going to be talking about what you can do in a first aid scenario when dealing with a hedgehog that has a suspected fracture and what will happen in a veterinary environment. An introduction to first aid, triage. Triage is something used by veterinarians to determine the level of emergency of each patient. Triage should be completed first to ensure the most severe and life-threatening injuries receive medical attention as soon as possible and not left to develop, possibly resulting in the death of the patient. Triage is done based on the following: bleeding and the amount of blood visible, whether the patient is conscious or not, if the patient has a pulse, how well the patient's blood is circulating, the colour of the patient's mucous membranes, and how long it takes the patient's capillaries to refill. Dr. ABC. Dr. ABC is a method used by veterinarians and is recommended to anyone to use in a medical emergency. Dr. ABC is important to remember as it assesses the potential dangers to the patient and to the persons involved. Dr. ABC is also used to determine whether or not the patient is still alive, breathing, and has good circulation by checking their vital signs. Dr. ABC stands for D. Danger. Check for dangers and remove them safely. For example, moving the hedgehog off the road once there are no cars coming. R. Response. Check if the animal is responsive. If it is a wild animal, it might be aggressive. This needs to be taken into consideration when approaching. A. Airways. Check the animal has clear airways by monitoring its breathing and checking for possible obstructions. B. Breathing. Monitor the respiration rate of the animal and ensure that it is breathing. This can be done by feeling the chest, watching each breath, or using a mirror in front of the nose and mouth. C. Circulation. Circulation can be checked by looking at the mucous membrane colour, for example, the colour of the gums. This ensures that the patient still has a steady blood flow and heartbeat. First aid equipment. It is important that our clients have access to first aid equipment when they are at home, as having the necessary equipment on hand in an emergency could make the difference between a successful recovery and permanent damage, or life and death. Important equipment to have in an at-home veterinary first aid kit includes non-stick bandages, scissors, cloth to use for restraint or to control bleeding, dressings, tick remover, sterile gauze, saline solution, oil blanket, tweezers and gloves. It can also include flea treatments and some pain relief. Health checks. Health checks are used as a method to maintain animal health and to keep record of any changes that occur. These can be weight loss or an increase in pulse rate. Health checks are also used during first aid scenarios with new patients. This is to check the overall body health of the patient and to find any other injuries, diseases or illness that the patient may be suffering with. Health checks include eyes, ears, mouth, teeth, gum colour, nose, coat condition, skin, overall body, genitals, paws, nails and pads, weight, body score, mucous membrane colour, capillary refill time, pulse rate, respiratory rate and temperature. The scenario. What is a simple fracture? A simple fracture is when a bone clearly breaks in two. The symptoms are internal bleeding, pain, swelling, loss of function, crepitus, which is the sound of crunching or grinding bones, and lameness, which is the lack of movement of one limb. First aid and handling. In this scenario, the hedgehog has been hit by a car and it has a suspected fracture. Before administering any first aid, Dr. ABC is carried out to ensure there are no other injuries such like internal bleeding or nerve damage. These would need to be treated first. As well as this, Dr. ABC should be done to assess the dangers surrounding the patient. As this incident occurred on the road, the first job is to move the patient out of harm's way. The hedgehog should be gently picked up using a blanket or coat to protect your hands from their spines and to offer some comfort to the patient. When handling hedgehogs, it is recommended to pick them up using 2 hands underneath their stomachs, as this prevents the patient from curling into a ball and to protect the hands from their spines. If the hedgehog has already curled up, scoop them up from underneath using 2 hands and carry them in a blanket on their backs. Once this has been done, you can proceed with administering the needed first aid. Next, other injuries such like the previously mentioned internal bleed or nerve damage need to be investigated, as these injuries can lead to permanent damage. In this scenario, there are no internal bleeds or nerve damage, so you can now proceed to investigate the suspected fractured limb. There is no exposed bone, but there is reduced mobility and swelling, which are symptoms of fractures. To perform first aid on a suspected simple fracture, there will need to be support given to the limb. This can be done using splints or wooden lollipop sticks to reduce mobility and padding. The next step is to get the hedgehog ready for transportation. This could be done by preparing a pet carrier with blankets or towels and put the hedgehog inside, then transport to the nearest emergency clinic. Pre, post and perioperative care. Once the hedgehog has arrived at the emergency clinic, it will go through a triage assessment to determine what level of emergency this case is. This will be more likely to happen if the practice is busy with emergencies. The hedgehog will be given pain relief, either orally using food or via a cannula. After this, the hedgehog will be put into a cage and monitored by the veterinary nurses. Soon after this, the hedgehog will have an X-ray. To stop the hedgehog from moving, it will be sedated during the X-ray. This is to make sure the scan is accurate so that the veterinarian can be sure it is a fracture and give the hedgehog the necessary treatment. Once the veterinarian has diagnosed the hedgehog with a simple fracture, they can begin treatment. In this case, treatment will be being treated for ticks, fleas, parasites to reduce any possible issues during treatment and during recovery. To treat the ticks, a tick remover tool should be used. This can remove the whole tick relatively painlessly, so there is no need for any pain relief. Next, a cast is made from plaster of Paris and will be applied. This will hold the fracture in place and allow the bone to fuse back together. The cast will have a stocking underneath for comfort purposes, as it soaks up sweat and reduces friction. The cast will also have a cohesive bandage layer on the outside of it, as these are hard to break and somewhat water resistant, meaning it will protect the cast. However, cohesive bandages can slip off if they are not done tight enough. Plaster cast is cheap and usually effective on simple fractures. However, they can be uncomfortable to wear as they cause friction sores and they only work on limb bones. Pre, post and perioperative care and husbandry. After the procedure, the hedgehog should be transported back to its cage. Vital signs, behaviours and weight should be monitored and recorded. Post-operative care for this scenario would be resting the limb until it is healed, while giving the appropriate amount of pain relief, either orally or via injection or drip, which will be held in place using padding, tape or cohesive bandage. The types of pain relief that can be given are pethidine and meloxicam. Levels of pain can be characterized by vocalizations, aggression, reluctance to move, and temperature changes. During this time, barrier nursing should take place to reduce human contact, as wild animals can easily be imprinted on and begin to rely on humans for food, reducing their chances of survival in the wild. The hedgehog should be fed a mixture of cat food and kibble. This offers the animal nutrients, hydration, and mimics their natural diet while in captivity. Their feed should be high in protein and calcium, as these are the nutrients required to repair the body. They should not be fed mealworms or marrow worms, as they can cause calcium deficiency, which could potentially make the condition worse. Once the course of treatment and pain relief has concluded, the hedgehog should be transported to a hedgehog sanctuary. This is to improve the welfare of the animal and give the fracture time to heal in a safe environment. The veterinarians will use this time to assess whether or not the healed fracture will have any effect on the mobility of the hedgehog, which could reduce the likelihood of survival if released back into the wild. This will be a decision the veterinarians will make. The hedgehog will return to the veterinary clinic after 6 to 8 weeks of the cast being put on. This is so the cast can be removed. Depending on how the fracture is healed, the hedgehog may need to have a course of physiotherapy to regain strength in that limb.